David Rakoff. And we'll record here. My name is David Rakoff. I'm the director of the Stanford Center for Population Health Sciences, and I'm really excited to have you all joining today to hear about our 2023 Spectrum Pilot Grant Program. This is a grant funded and supported by Spectrum, which is the Stanford Center for Clinical and Translational Research and Education. And Spectrum does so many things around Stanford that have a big impact and a lot of different pilot grant programs. But today I'm talking about this specific one for focusing on population health projects that we coordinate here out of the Center for Population Health Sciences. So I will say we're recording just for the sake of people who couldn't attend at this time, so they could listen to the information session and get a sense of things. But to take advantage of you all being live here, live remote, please ask questions along the way. So you can put questions in the chat. That'll remind us and make sure you won't forget the questions. And then at the end, we'll come back and answer the questions that you've put in the chat. So with that, let's get started. Go ahead. So the agenda today, I'll talk a little bit about our center, PHS, and the work that we try to support and promote. Then we'll talk about the request for proposals this year, which is pretty similar to last year, but a few differences. Get into the specifics of the requirements and eligibility. And then I'll turn it over to Isabella Chu to talk about the PHS data and resources that we have here. It's not required that you use any of our data sets for any of these applications, but every year there's a number of good applications that we fund that use our data, and it really fits with what we're looking for. So again, not at all required. We definitely fund things that don't use PHS data for sure, no question, but just want to make sure you know about those in case it's a fit for your projects. And then we'll talk about the application timeline and have some time for Q&A. So our mission is to bring together diverse disciplines and data in order to address social determinants of health. And so these are going to be key parts of what we're looking for in these pilot applications, thinking about bringing together different perspectives and also really using data, primarily quantitative data, in order to think about the impacts of social determinants of health on both overall population health, but in particular on health equity. We think about these four things that are important in terms of supporting research. One is that collaboration, both between scientists and also between the communities and the public with scientists. We provide research resources. A big part of that is data, but also really knowing how to use the data and thinking about best practices with data. Translation is how we think about not doing research just for the sake of because it's something interesting, although that's usually a part of what we do, but that's something that's going to have an impact, and either short or long term, but something where there's a real clear thread of why this would matter and why this work could have an impact on an important health problem. And then education and training, which kind of involves all of these, but really helping and supporting people to use data and collaborate in the most effective ways possible, with the impact as being the end goal that's always in mind that motivates us to do all of this work. Next slide. So what is population health? In the interest of time, I won't spend the whole hour on this, but it is a term that can mean a lot of different things to a lot of different people, and that's fine. I think everyone's going to have a slightly different definition of this, but it may be helpful for you to kind of think about the way we think about it and what we mean when we talk about population health. And so one of the closest sort of papers, and it's a very accessible sort of short article now 2 decades ago in the American Journal of Public Health, is this pretty important paper by Kindig. It started at a time when people weren't really using the term population health. And, a lot of times in the past that these similar concepts were referred to as public health. And there's certainly a lot of overlap there. But we think about population health as something that starts with starts with thinking about what are the things that we could do to impact the health of populations. What are the health problems we're seeing, and working back from there to see what influences those within a system. And it's a little bit, and it's, I draw a distinction between sort of epidemiology, for example, which is a little more the science of how you do that analysis, and population health being a little more inclusive of the systems and policy and all of the things that go together to try to focus on what actions we can take to improve the health of populations. And so it's a really action impact driven term and concept. And Kindig started go into it a little more there. But this is what sort of drives us, differentiates us from thinking about individual patients and thinking about what health problems are there in the population, especially as they relate to equity, and what kind of research or processes would need to be done to sort of improve that. Next slide. So I also talked about the importance of social determinants of health for what we do. This is something that over the last few years has gotten a lot more attention. It's certainly not a new concept. Research has been focused on social determinants of health for many centuries, essentially from the beginning of when we've collected data. People have looked at social determinants of health and the influence on the health of populations. We refer you to this kind of updated, pretty accessible summary from the CDC and how they think about it, and focus on these 5 sort of domains. Healthcare access and quality is definitely a part of this. But because there's so many other resources and other pilot programs, at Stanford that focused on healthcare, we're generally focusing on trying to think about supporting projects in these other 4 buckets. This includes education, access, and quality, economic stability, social and community context, and neighborhoods and the built environment. So this is what we're interested in supporting in terms of work, which is pretty broad. I think, over the years, we've seen a real variety of projects that we've funded, some much more on sort of health systems, some on physical and the physical environment, but then certainly a lot of projects looking at the social environment and the impacts there. There's 2 sides of this. There's both on the exposure side, thinking about a social determinant of health, as we've outlined, and then also kind of on the outcome side, thinking about what type of things what type of work would really support what we can do to reduce social inequalities or inequities in health. And your project, these are relatively modest awards. We don't expect you to change the world or have a measurable long-term impact on social inequities with this one pilot project. But we would like to see just your kind of thought process on what's the sort of long-term objective, how can this research funding support work and research that you think would have this demonstrable impact on population health and health inequities over some period of time. And so, we're very open and aware of the difficulty of doing that, but we're just really interested in these proposals and at least you kind of mapping out how you think this would have an impact. And some of that has to do with populations that have been under-resourced or under-researched in the past. But it also has to do with sort of the overall impact, on being an important public health problem as well. So from like an epidemiologic perspective, a lot of times we talk about like a population attributable fraction. So talking about that kind of thing, that it's either an ignored problem or a problem that's, pretty large in magnitude that we should really be addressing more seriously with research. Next slide. Okay, so we have 2 types of grants. One is for an early career, which is kind of mostly PhD students and postdoctoral scholars for up to $20,000. You need to be partnered with a PI who's a faculty for that. That can be written down, but you can be listed as a co-PI on that award. This is also something for any PhD students and postdoctoral scholars out there. Not only are these funds useful, but it's also kind of useful experience to write a grant, to get funding, for your biosketch and CV as you move along. And then there's faculty grants, which are a bit larger, up to $40,000. A really important thing to note as you think about your project. These are funds that really need to be spent between July 1st and June 30th of this next year. So think about the scope of your project, think about how long it might take to get data. Oftentimes, if it's new data that you've never accessed before and sounds like a good idea, that's something that can take about a year. So really keep that in mind, and that's something we look for. If there's data that you're using or proposing to use, if it isn't PHS data, just make it clear to us that that's going to be things that you'll have in hand, ready to kind of run at the beginning of the program, or that you have a good plan for sort of collecting that data and using the funds within the timeline. I mentioned this before about projects must list a Stanford faculty member, and there's a few other things that I'll just let you read here on the slide. And I would say, these are definitely things we can talk more about in the Q&A session, but as questions come up, reaching out to Eileen and Ellen, and they can really direct you. There's sometimes gray areas here that on a case-by-case basis we can respond to, and definitely do that ahead of time so you can, adjust things accordingly and not go down this road and not be eligible for a project. Next slide. So evaluation criteria, important slide here, which really just kind of summarizes a lot of what I've already talked about in terms of what we want to fund, where we see our niche, and where we see important work that we want to support. So again, this idea of the potential impact of the work, really bringing in social inequality fundamentally to an outcome of the project. The methodological rigor is important. It's we've intentionally kept these applications pretty short, so you don't necessarily need to tell us every single how you'd code every single variable, but it's more kind of conceptually. Are you thinking about this as a causal study, a descriptive study? Why do you think you can get a useful parameter out of your study? And so also sort of measurement error, things like that. So we do look for the rigor of the proposed work as well. The scope and the budget, it's important to really try to find that sweet spot. We have, I think, realistic expectations about what you can propose to do in a year. And so, it's better to be realistic about it. And it really shows us that you understand the work, you understand what's involved. If you propose something that, maybe isn't super ambitious because of the amount of funding and the scope. And then training's, really important. I think we want to support people on their trajectory, but, we're particularly interested in hearing how this might bring your work in a new direction that, as a shift towards looking at social inequities in health, a shift more towards population health, a shift towards social determinants of health. So it's always useful for us to hear about sort of your work in the past. If you're already doing that kind of work, we don't hold that against you. We want to continue to support your work in that area. But this is also part of kind of training and building, pilot data that could lead to longer term projects. And I think from there, I'll turn it over to Isabella to talk about some of our data.
Hello, everyone. I'm Isabella Chu. I'm the Associate Director of the Data Core at the Stanford Center for Population Health Sciences. And we have a number of great data sets that can be used for population health research. The first of these is the American Family Cohort. This is about 8 million individuals distributed across all 50 states. This is outpatient electronic health record data. And it's very rich. So if you have exposure data, it can be linked by individual by the data core to AFC. We have all payer claims for the state of Colorado. So that's all of the different types of payers in the state. That does require a reuse agreement, but these data are really good if you're looking for a very representative population. These are rich, they're granular, and they're also linkable by individual. And then the third data set that I wanted to talk about is the California Data Agency Data Exchange. This has a pretty long time horizon to application and access. So if you are considering this one, you should probably start very soon. But basically, the state of California has linked Medicaid or Medi-Cal as the spine and linked a number of social services data sets by individual to Medi-Cal data. They have limitations. You can read the slide. And with all data sets, there are generally trade-offs, but these are all three very good data sets for population health research. The next slide, please. These data sets are all very similar with respect to these are all claims data sets, so Market Scan, Medicaid, and Medicare. They're all national data sets. They're all claims data sets. So, when you go to the doctor and pay your bill, it generates a record. So these are from insurance claims. Market Scan is commercial insurance and very representative. It has about 100 million people. It's not particularly granular with respect to geography. We have down to 3-digit zip code, but we do have a number of new files. So we have dental data, we have lab data, and it includes a large number of payers. So Market Scan can be a very good data set if your question can be answered using commercial insurance. We have 100% of Medicaid data. So obviously, if you're looking at a study for individuals lower socioeconomic status, this is very good for looking at children. And we have it for the entire country. So this is a really good data set. The catch is it takes a long time to apply for it. So again, if you're considering using this data set, I would encourage you to reach out and start really early. And then we have 20% of Medicare. And again, this is for the country. So Medicaid, we have 2011 through 2019. Medicare, we have 2006 through, we'll have through 2020, probably by summer. Great. So this is just a quick snapshot of all of these data sets. We will be sending out these slides, but what you can see is there's always trade-offs. So for example, a data set may be very, very rich, linkable by individual, but typically it'll have a smaller sample size, or a data set will be huge, broadly representative, but only from, say, commercial claims, things like that. So this is sort of a snapshot of the strengths and weaknesses of each of these data sets. There's another, I did want to note that there is if you want to use Medicaid, there is a second pathway where we have a contract with a company called Mathematica, and they have a seat on the VRDC. And because we've already executed a contract, we could probably get a contract executed in about 3 months. So if you want to use Medicaid data, there are sort of 2 pathways to using those data. Next slide, please. So obviously, in a very short amount of time, we can't go deeply into each data set, but on our PHS data portal, there's detailed descriptions of all of these data sets. If you apply for metadata access, you can see what variables are there, the distribution of the cells, or I'm sorry, the distribution of the variables. You can kind of do some preliminary work to see if the data set would work for you. We have detailed instructions on how to apply for access. We have Slack channels, and we have a group email. Next slide, please. So, additional resources. So in addition to the data, we can help you identify awards, help connect you with people who can help you. carry out the project. We do know something about, say, access to analysts, things like that, although that almost always requires funding, community engagement, and research management. And finally, we have new mechanisms, particularly for data dissemination. And so if you were interested in any of these, please reach out.
And I'm happy to jump in a bit here, Bella, regarding this slide. Yes, so thank you, Bella, for that. I was just going to say, for data, as you said, in addition to facilitating access to large data sets, well-curated data sets, we can also provide you other resources that will enhance your research, and a lot of which may be particularly useful if you're in the early stage of your academic career. For the funding piece, the help identify and secure awards that you had mentioned, the first resource we can offer is really funding support. And this is not limited just to sponsoring projects through our grant opportunities, such as this pilot program, but we can also offer services in identifying new funding resources and can provide advice and guidance on your proposals prior to submission. On the matchmaking piece, I wanted to say we can also offer you networking support here, if you will, where we can help you connect your ideas with other faculty and trainees who may be exploring similar topics. We have an extensive network of partners and collaborations, both within Stanford, but also through the US and globally. For the community engagement, I would like to mention that the most impactful population health research must incorporate some level of community engagement, as Dave had said also earlier. And as a result, we can provide assistance in making those linkages, either through our close connections with the Stanford Office of Community Engagement, or by linking with some of our local partners throughout the Bay Area. We have quite a few of those right now, including county public health departments. And for research management, for projects in which PHS is more directly involved, we can also provide program management support to help move your plans forward, convene stakeholder meetings, and to really drive the projects forward. And lastly, but not least, the dissemination piece, as Bella had said, we want to make sure that the research being conducted at Stanford doesn't just stop at publications. We want to make sure it gets into the hands of the people who need it most. And of course, these are the policymakers. And let me just go to the next slide here. So the application deadline is open. Thank you for those who have already started to apply. We welcome your applications until February 28th. So 11:59 it would close. Notifications would be possibly April 7 is our targeted date for that. And for that, so those who will be awarded, you're required to attend a pilot awards office hours on April 13th. And we will send you, of course, the details of this. This is required only for awardees. The grant awarding period would start on the 1st of July and end on June 30, 2024. And as we had said earlier, this is a no extension funding. And for any questions you may have, I'm here to answer them. Anything related to the project scope, application review process, and award notifications. And we want to also introduce you to Eleanor Rasa, who's here right now with us, who has been very helpful. She's a KL2 manager, and she's here to answer also any questions related to eligibility, application, documentation, and online application submission. So if there's anything else that we have, I wonder if you have any questions right now, we're here to answer them for you. So David.
Yeah, I'm going to go through some of these questions. I'm trying to see which ones were. For the NIH training grants, I guess I could see a scenario where, faculty could have a K. So it sounds like a K would disqualify folks from applying if they currently had a K award. Is that correct?
Yes, if the period overlaps with the pilot period, then they won't be eligible. But this only applies to K scholars and T trainees. If the applicant is a PI of a K grant or T grant, then they're eligible to apply.
Okay. And then getting back to just to clarify Alexis's question here earlier. So if someone had a training grant that they'd submitted, they could still submit this. And as if their funds, let's just say their K started in January 2024, but we didn't know that at the time, we awarded it, they could still kind of spend the funds on things up to that time when their K award would start?
Yeah, that would probably be okay. And we've ran into the situation before. It's we treat these on a case-by-case basis, but if they're able to get approval from their NIH program officer for work on this project, then they can still work till the end of the grant. So it just depends. And the work, of course, has to be related. It's the pilot grant is related to their NIH project. That's usually okay too, as long as the NIH program officer approves it.
Thank you. That's helpful. So, go ahead, Brian.
I had a quick follow-up question on this, and this is obviously the narcissistic asking just about myself question, and my apologies. I'm faculty on a K08 as of a couple of months ago, and is it possible to apply, if I'm not using it to fund any of my time, but rather to support actual program implementation, is it possible to apply for that, or is being on a K make me ineligible full stop?
Oh, I have to look into, because I think in the past, what would happen is that the effort would be subsumed. So the effort that you would you contribute towards the pilot grant would be subsumed under your K award, which is the reason why we would have to obtain NIH program officer approval.
Okay, yeah, I was thinking about doing it 0% effort for me, and then just I have some people that I need to support for actually doing the work that I was looking for the funds.
Mm-hmm. If you can obtain, like if you have that discussion with your program officer and get that approval ahead of time, then we can definitely look into it and accept your application.
Cool. Thank you so much.
Great. Thank you. Yeah, and I was just going to say, I'd strongly encourage folks, if you're in the process, at least this would be my advice for like my mentees, if you're applying for a K award, but it's a few, funding would be 6 months down the road, like I would suggest still applying for this. It's good to have multiple things in multiple potential funding ongoing. So don't let that stop you. Let's see, other questions here. Alexis was asking about recommend applying for access to data, especially Medicaid, via either pathway prior to application. Would it weigh on the funding decision? I think, Bella, if you feel pretty good about that, I don't think we'd normally expect people to do that yet. I think what would be great is to just like reach out to, if it's data specific questions, you can reach out to Bella, talk about, this is what I was thinking of proposing. What do you think the timeline is for that? And then as long as the timeline, is kind of within a 3-month period or so, probably would work out well. But I just double check with Bella on that, and then you can put it in your application that this is something, personal communication, and talk about that. But I don't think you'd have to formally do that application ahead of time. We wouldn't hold that against you. A question from Rosina: are the early career grants restricted to doctoral students and postdocs? It just shifted. Can early career research fellows at Stanford also apply? Yeah, that should be fine, right? Yeah, absolutely. Oh, and that reminds me of something that I didn't mention on the slides. I forget if that came up from someone else, but you don't have to apply for that full amount either. And in fact, we encourage you to apply for an amount of money that would be under the 20,000 or under the 40,000 if it's what you need for the project. Because as we're kind of balancing this out with the amount that we can fund, sometimes we're able to fund kind of smaller projects if they kind of sum up to the amount of funds we have. So to think about that as well. But yeah, I would say that, the kind of distinguishing breakdown is, do you have kind of a faculty position at Stanford versus like not a faculty position? And if it's not a faculty position, you could be considered on the trainee early career grants. But if you want to double check with us on any of those kind of questions, we can. So, okay, good. Other questions from folks? All right, well, feel free to, thanks so much for attending and listening, and feel free to reach out to Eileen directly, and she can, if she can't answer the question, usually she can, but if she can't, she also knows the best people to ask to find out for you. So thanks everyone for attending, and we're looking forward to reading your applications.
Thanks, everybody.
Thanks.